Ambulance collisions, which happen with frightening regularity, often result in injury and are occasionally fatal, especially for private vehicle drivers. With millions of miles traveled annually, EMS providers must take precautions to reduce crash risks. Assume other drivers are distracted, impaired, or reckless. Drive defensively, anticipating the worst possible decisions from others. Always wear your seatbelt. Adjust speed for road conditions. Eliminate distractions such as phones, radios, and food. Stay alert and scan for hazards. When stopped, minimize exposure to traffic and use emergency vehicles as shields. Move with urgency out of the hot zone and away from the roadside to safer areas. Many ambulance crashes involve emergency lights and sirens, even though their impact on patient outcomes is minimal. While they grant the right of way, they also raise the risks of a collision. Patient transport is not always an emergency. Consider alternatives such as personal vehicles, ride shares, or BLS, ALS transport, based on patient urgency and severity. Reducing ambulance crashes requires vigilance, defensive driving, and an awareness of legal and financial consequences.